Hello everyone. We are talking today about a very important subject to those of our viewers who suffer from varicose veins and spider veins. And the subject is, how do you choose who should treat your varicose or spider veins? What are the questions that you need to ask when you walk into a practice to determine, is this a practice that can really help you? So I've invited Dr. Jose Almeida, who is a board certified vascular surgeon and is world renowned for his work in all kinds of vascular surgery, but especially in varicose veins. And thank you for joining us, Dr. Almeida.
Thanks.
Okay, so what are these things that we need to ask to choose the right person to treat us?
Thank you for choosing this topic. It's completely germane. There's problems out there. And so if you're a patient, you're entering a vein clinic, you should really just ask a few basic things, and they really all involve, is your doctor properly credentialed to do these procedures? So number one, what the type of specialty? In my mind, of course, I'm a little biased, but vascular surgeons, that's vascular, blood vessels, and surgeons we train to operate would be the most qualified. We know how to do catheter-based procedures, we know how to interpret the imaging, we know how to operate and use catheter-based technology, which is everything that we use in venous disease. If the response is, I'm a family practitioner, that should be a red flag because they don't have training, procedural training. They probably went to a weekend course and they're offering you these invasive procedures. So does the doctor have hospital privileges? Why is that important? Well, hospitals vet you. One has to go through a credentialing committee to get privileges to do these procedures. Whereas in an office environment where many of these take place currently, there is no vetting process. One can set up shop legally to do whatever they want, including brain surgery in the office if you choose to do that. I mean, it's really that crazy. The other thing is the ultrasound examination is important, and your vascular lab needs to be accredited. That guarantees that you've gone through rigorous protocols and that the information that you base the diagnosis on is accurate. Another thing that we're seeing out there is patients being told they need 4 and 5 ablations for treatment of their varicose veins, and that's just flat out fraud. We do these procedures at one setting. On average, we'll ablate 1 vein or maybe 2 veins in the same setting and remove the varicosity through something called a phlebectomy. So it's really one and done. Whereas patients are being offered to come back every 2 weeks and get laser ablations of 3 veins in one leg and 3 in the other. And when we see these people's second opinions, many of them don't need anything. And the last one is really horrific. People with these little benign spider veins on the skin are being told that one should be looking for the root cause. So they get these ultrasound examinations and they're being told that they have internal vein problems requiring ablation, and that's another thing that's just flat out fraud. The treatment for spider veins are sclerotherapy, and it's not even medically necessary. You can leave them there, they're completely harmless, but they come from the skin, they don't come from inside of the leg, and they certainly don't mean your circulation is bad. So these are really the key things that if you have a vein problem, you should be asking. Why? Because unfortunately it is the wild, wild west out there, and there's a lot of bad things going on.
Thank you so much, Dr. Almeida. I'm so glad you joined us today. Remember that here at MedQuest, we aim to make your quest for accurate and up-to-date information easy and successful. Our goal is a healthier you. Please hit the subscribe and share buttons below and give us a thumbs up. See you next time.